I have a question. Fortunately, we are here on a college campus whereby we do have counseling services and health services that are free to the students as long as they have insurance. We're talking about a specialized type of mental disorder. Insurance companies, not all of them, will cover the cost of getting the help that's needed, whether you're in college or in high school without insurance. What do you recommend or suggest that a person without that type of coverage do, or even how to go about finding anyone who can help them? I mean, do you turn them away or do you bring them in?
That's a huge issue that, this is going to sound weird because we're in California, but California is actually a pretty positive place to treat people with eating disorders because we have laws now that protect people that suffer from eating disorders. And so insurance providers can't exclude them from treatment anymore. And secondly, insurance providers have to treat them to completion. They can't just say, okay, you have 20 sessions and then we're done. We're done with you. They have to treat it like a medical illness. And so if you have cancer, you don't go in and the doctor says, okay, we'll give you 3 sessions of chemotherapy and we'll see what happens, but that's all you get type of thing. You get treated to completion. We, as a professional organization, our professional organization has developed practice protocols like this is what you should do to treat people with anorexia and bulimia. Unfortunately, the poor people of our state aren't afforded that treatment, and I don't understand why. We get calls every single day from people that are underinsured, not insured, or on Medi-Cal that don't get the appropriate type of treatment that the profession has said this is what people with anorexia and bulimia should be getting. I think it's a wonderful story because I think it's horrific how our poor people get treatment or don't get treatment.
I think there needs to be an awareness that there is programs for children under the age of 17, that there is a program called the CHDP program that they have through Public Health Department, that is a state-funded program for any child, even if they don't have insurance, and if they're identified through the physical, that they do have some kind of disability or a diagnosis that needs further treatment. The state has a program that will refer them to UC San Francisco or UC Davis. So I think it's building an awareness to our community to know that there are programs, and it doesn't matter if a child doesn't have insurance. The community leaders that are having this type of programs to know where to send a family that doesn't have insurance, because the state actually does have programs. So that's sort of a myth, or maybe not enough information out there to think that if you don't have insurance, you're disqualified from treatment. There is a program there for every child.
One of the
going through the public health department is the source to go through.
One of the I've treated a couple of people, not with eating disorders, but with other physical things through that program on an outpatient basis. A lot of the people who have problems accessing or have a lower economic status, they also don't have the transportation to get to up there. I've had a family where both parents had to work to pay the bills, and neither of them could transport the child every day out of town. And what they did was the mother quit to stay home to make sure that she could help her kid. So it's hard, and especially in this area. I actually have one therapist, outpatient therapist, who is qualified to treat Medi-Cal. So one of the first things I'll do is get the kids signed up for Medi-Cal.
And they do have case manager nurses that do have transportation for a child too. So that's also,
Come and pick them up every day?
I don't know about every day. I don't really work with them, but I do know that they have case manager nurses that are supposed to help the child for transportation to wherever they need to go. So that shouldn't be an issue either.
My friend is hospitalized for an eating disorder. Should I call her? What should I say to her? How can I help?
Did you want your friends to call you when you were an inpatient?
At times. I mean, I guess it just depended. When I first got into the program, it was kind of mixed emotions. There was times where I did want to talk to people, but at the same time, I was focusing on myself. And at that same time, I was a little I was kind of embarrassed, to talk about it to people, especially with people that don't have the education on eating disorders. And when they call and they ask certain questions like, oh, did you eat today? Or did you go to the bath? Like stuff like that, and that just makes the program worse. So I mean, it can go both ways.
So it depends on the person. Ask. Do you want me to, can I call you while you're in treatment?
I just, I get this question a lot, like, I have this friend with an eating disorder, what should I do type of thing. And my response always is trying to understand what it's like to have an eating disorder. Really trying to understand from his or her point of view what they might be going through. And that allows you to be much more compassionate. People with eating disorders are suffering tremendously. I tell them all the time, I tell my patients, you guys aren't doing a good job letting people know how much you're hurting inside. Because they walk around with smiles on their face, and you say, how's it going? It's fine. But really inside, they're hurting a lot. And when we kind of slow down enough and really try and understand it from their point of view, and we see how much they're hurting, it allows us to be more compassionate. And that's what these patients need, is they need a lot of compassionate and love and understanding. Because they need to be guided down a path they don't, that their brain is telling them not to go down. But if they see that you're there and you care about them and you're trying as hard as you can, they're more likely to do that.
Who's hospitalized? Is she going to die? Why is she hospitalized?
People usually get hospitalized for medical issues. And so when people die from eating disorders, they die from two different issues, cardiac issues and then infection. And infection, what happens is they get some sort of virus, or they get sick, and their body is so compromised they can't recover from the illness. And that can be very scary, because how people die from eating disorders is they usually go to sleep and they don't wake up the next morning. The cardiac issues, oftentimes you'll see a slowing of a heart rate, or you'll see different orthostasis, where there's a significant change from your sitting and standing heart rate, because the body is having to work harder to pump blood from the feet when you stand up. And so what you're looking for is any sort of dizziness, heart palpitations, any kind of cardiac symptom. And if your friend has any of those symptoms at all, immediately see a doctor. He or she will minimize it and say, oh, everything is fine, it's not a big deal. I actually had a patient one time that I saw for a session for 45 minutes. So we talked for 45 minutes, and when she got up, she was hugging the wall. And I asked her, what are you doing? Why are you leaning against the wall as you're walking down the hall? And she says, I'm really dizzy. Well, how long have you been dizzy? All day. And she sat and talked to me for 45 minutes and didn't mention it at all. And so if you see any sort of symptoms like that, it's very important that you're attentive and you talk to your friend and say, hey, that's not normal. I'm worried about you. We need to see a doctor.
What self-prevention tips would you give to someone who's experiencing the eating disorder symptoms but doesn't have the disorder itself?
I would suggest they go talk to a dietitian. Say, look, this is how I'm eating. I'm trying to eat healthy, but the dietitian, I think, is a perfect person to go and talk to initially. And then the other is to look at what is the stress that's going on in your life. Because eating disorder isn't going to come out if there's not stress or anxiety or depression. So then it's also, what is going on in my life that's making me sad, that's making me stressed, that's making me anxious? Is there family issues? Is there boyfriend issues? Is there girlfriend issues? Is there, academic issues? And talk to somebody about that. Don't just try and forge ahead and I just got to make it through the end of the semester and then I'll take a break. Because when we're stressed, our mind tells us to work harder, not, oh, why don't we take a break? I mean, our body works against us sort of in that way. So it's reach out and seek help. I think I'm having this problem. Go see the dietitian, go talk to a counselor.
Something else that you can do is almost a self-assessment, is change up your routine. Do things differently. Eat dinner for breakfast, eat breakfast for dinner. And oftentimes people in the early stages of eating disorder, and even the latter stages of eating disorder, are so rigid in their behaviors, they're not able to change things up. just step out of your routine and see how much anxiety that causes you.